Hello, my name is Michelle Tran, and I'm excited to share with you our idea for the University of Texas at Austin's project for Prescription for Service. Our project focuses on serving an often neglected population in the United States, the refugee population. A refugee is defined as someone who is unable or unwilling to return to their country of origin owing to a well-founded fear of being persecuted for reasons of race, religion, nationality, membership of a particular social group, or political opinion. In 2018 alone, an estimated 22,000 refugees entered the United States, with approximately 4,000 refugees arriving from October 1st to November 30th. Of these refugees, Texas had the largest refugee arrival population, totaling 352 individuals. This is a growing population in our country with little resources and education of the American healthcare system. The stressful process of adapting to a foreign country, as well as financial and cultural barriers and the lack of access to healthcare, have all led to health disparities in this group of individuals. There is a need for resources and tools to engage this population in order to reduce the barriers to care and assist in navigating American healthcare institutions, such as American pharmacies. We believe that focusing on American pharmacies in particular is important for refugees because many foreign pharmacies operate very differently, and the differences may be confusing to refugees, which could deter them from utilizing pharmacy services. For example, it has been shown that patients in developing countries are able to go to pharmacies and obtain a wide array of medications without a prescription. In many countries, over half of all antibiotics dispensed were given without a prescription, even though one was legally required. This lack of legal oversight in other countries may give patients an unrealistic expectation of pharmacies in the U.S. As pharmacy students and future pharmacists, we believe we can step in to provide this much-needed education to engage this population and help them gain a better understanding of American pharmacies. Our goals for this project include providing a video to improve refugees' knowledge of American pharmacies, increasing refugees' willingness to utilize pharmacy services, and collaborating with local refugee services to reach this population. Our current plan consists of filming at a local Walmart pharmacy to create a short video, which will explain the differences between OTC and prescription medications, the process of filling a prescription, what information is needed from the patient by the pharmacy, and the other services that pharmacists can provide. We plan to partner with local refugee service organizations that will ensure that we have professional interpreters for accuracy and cultural competency. The finished video will be played on monitors that are installed in the waiting areas of our community partners. We plan to partner up with the Center of Refugee Services of San Antonio, or CRS, to implement this project. CRS is a volunteer-run, nonprofit organization that provides resources to legally resettled refugees for successful and sustainable community integration. We will have their organization leaders review and approve of our final product to ensure that it is appropriate for refugee communities. One of the many partners of CRS is the UT Health San Antonio Refugee Clinic, which is open every Wednesday evening and run by various health profession students and faculty from the UT Health San Antonio School. At this clinic, they address the health and social needs of about 5,000 refugees living in San Antonio. We believe that this is a location that would be a great starting point for our educational video because the primary goal of this clinic is to serve as an initial trustworthy location for refugees to overcome their inhibitions and adequately address their healthcare needs. Once the video is completed, we plan to survey patients prior to viewing the video as they arrive to clinic. We will be able to provide translated written surveys as well as verbal interpretation for patients who may be illiterate. While patients wait to be seen, we will play our educational video in multiple languages. After viewing the video, patients will work with our interpreters to fill out post-surveys. These surveys will be collected and the data will be analyzed to evaluate the video's effectiveness. We will need to purchase a television and wall mount, a USB flash drive, and medical interpreters that charge $25 per hour. We will also require printing services for the paper surveys that will be distributed, and lastly, to make sure our video is of professional quality, we will be hiring a filmographer to assist in filming and editing. We hope to show that providing video education to incoming refugees about American pharmacies can demonstrate an improved understanding and increased access to care. We believe this project will lead to a long-lasting and sustainable impact on the current and future refugee population in America, and we plan on furthering the reach of this resource through additional languages, expansion of partners, and social media outreach. Thank you for your consideration. We are excited to potentially work with you all in implementing this project to impact the lives of many refugees.